Hello, this is Joel with Achieva Rehabilitation, provider of physical therapy in Schuylkill and Luzerne counties. We come right to your home with our intensive 60-minute one-on-one sessions. In this podcast, we're going to be providing some tips and tricks and advice for different things that people are suffering with. Please continue to look for new podcasts as they roll out, and we hope you sincerely gain some value from today's podcast. In today's special podcast on actually improving your balance, I will share with you some very powerful principles and strategies you can make work for you, some over time and others almost instantly. The podcast will show you how to actually fight back against balance problems for no cost whatsoever, other than that of your time. And that's what most people who listen to this podcast are shocked to discover. They're shocked to know that there is a definite way to gain life-altering improvement and education with regard to your balance without needing a referral from a doctor or speaking one word to your insurance company. So my challenge to you as you listen to this, as you are gaining the knowledge that I am going to share with you, please take some time every day to try out at least one of these 100% natural strategies. It won't take long, and most of them won't cost you anything but a few minutes of your time. I think you'll be pleasantly surprised by how much better and healthier you will feel for doing so. Before we get into the information, I'd like you to know that we have a few different ways that we can help you out other than the podcast, our videos, our free ebooks. Number one is we offer a free discovery visit where our specialist physical therapist actually comes to your home, spends about 20 to 30 minutes discussing your case, and then helps you make the best decision that you can make going forward. Whether that involves physical therapy with us or not, all we care about is helping you make a decision that improves your quality of life. You can arrange for that free discovery visit by going to our website, www.achievarehab.com, and clicking on the Discovery Visit button. We also offer a easier route to developing a relationship with us, a free phone call with a physical therapist. This has been very successful with patients in the past. We spend about 15 to 20 minutes with you on the phone, no strings attached. Again, just discussing your case, discussing your challenges and your concerns, and helping you learn a little bit more about physical therapy in general and what our brand of physical therapy can do for you and how it differs from other companies. So you can take advantage of that as well by clicking on the free phone call from a specialist button on our website. Again, www.achievarehab.com. We also offer an even simpler way to get started with more free information. On our website, there are several free written reports that we can send directly to your inbox that are loaded with tips and tricks and advice relative to what you're going through. Go ahead and go to the website and request one of those, and we'll get it out to you immediately. Finally, you can call us or text us at any time at 1-888-929-7677. We'd love to hear from you, love to answer your questions, and tell you a little bit more about how we believe we can help you. There is no referral or no need to see your physician We are a direct access company, which means we can start the ball rolling for you. Of course, we do keep your physician in the loop because it makes sense to have all your healthcare providers on the same page and sharing information on how we're helping you. So, let's get started with our talk today on balance and falls. Balance is one of those things that you might not realize the importance of until you start to lose it. And for most of us, as you get older, that's when we start to lose balance. For some seniors and elders, poor balance and falling can start with medical issues that they have no control of. But for a good majority of people, it is simply a matter of losing strength and the natural ability to move the way you did when you were younger. In case you don't think you need to take it all that seriously, consider that falls are the leading cause of death from injury among people 65 and older. And it only takes one fall to take you off your feet for weeks or months, or possibly remove your independence completely. There is one statistic: the biggest predictor of future falls is if you've already fallen once. So what that means is anybody who's listening or has family members who are listening, if your loved one has fallen once, they are very likely to fall a second time, a third time, hopefully not many more. So, what causes balance problems? There are many causes to people having balance problems. Some are short-term, some are long-term. People can have infections in your ear, which change the way the inner ear works, which is very important for your balance. They can have gradual inner ear problems. A history of inner ear problems as a youth even can predict problems in later life. Head injury, if somebody has bumped their head or has a head injury in their history. Poor blood circulation to the brain. Certain medications, and I urge you to make sure that you're always checking your medications and how they're interacting with each other and discussing that with your physician. High blood pressure or low blood pressure can cause problems, specifically with dizziness, which is always related to balance. Neurological conditions such as Parkinson's disease, multiple sclerosis, cerebral palsy, old strokes, even things like arthritis will change your balance. The main area that we see is what we call multifactorial disequilibrium, which simply means that there are multiple reasons for your balance problem. We see this a lot in the elderly population. So if you or your mother, your father, or family friend are suffering falls and balance problems, it's likely because the balance systems as a whole and how they interact are not working the way they were when you were younger. If you're not terribly active, your fall risk also increases. So activity level goes down as you get older. Now, balance problems are not usually difficult to assess. Some medical clinicians believe that you must have a battery of testing in order to find the reason for your balance problems. But especially trained physical therapists can provide conservative assessment techniques that often lead to finding the problem and, more importantly, finding the solution to your balance problems. Doctors may often prescribe medications such as Antivert or Meclizine, which will help your dizziness, but it will never have a positive effect on the reason you have dizziness or balance problems. Antivert or Meclizine are neither a solution. They are both Band-Aids, and they just mask your symptoms and do not provide you a solution for your dizziness or balance problems. The number one thing that you can do to improve your balance, and yes, it absolutely can improve, is to be treated by a specialist physical therapist who is experienced in this type of care. So let's talk a little bit about prevention. A few tips for you. Staying active and participating in an exercise program, either a general one, such as walking, riding a stationary bike, or an exercise program run by a specialist physical therapist specifically for your balance, is the absolute best advice that we can give you. As wobbly toddlers, we worked hard to improve our balance and propel ourselves forward efficiently. We got better and better at balancing as kids, thanks to skipping, climbing trees, doing somersaults, and simply being active. But as adults, most of us have stopped doing those spontaneous movements. Instead, we spend a lot of our time sitting. During a commute, sitting at a desk, on the couch. The result is that our legs, our low back become weaker and our balance suffers. A more sedentary lifestyle isn't the only thing to blame. Parts of the inner ear and brain that control balance, collectively called the vestibular system, as well as your vision, decline as we get older, which has a big effect on your stability. These things are gradual slowdowns that may take years or even decades to notice. Maybe it's become a little bit harder to move side to side when you're walking outside, or you feel less stable as you head down your stairs, or maybe you're feeling too precarious in high heels these days. Feeling more confident about these and every other movement, like getting in and out of the car or watering the garden, is exactly why balance training is so important. What we do with balance training is encourage the brain to actually rewire the way it receives information. The brain receives information from different sensory organs, including your vision, your inner ear, and the sensation from your feet, your ankles, your knees, and your hips, and your back, to then make a decision as to which muscles need to work, how fast they need to work, and when they need to work when you are trying to move around and stay stable. So those areas that are affected, like we talked about earlier, make it a big challenge for the brain to tell the correct muscles to work and when and how often and how fast to work to keep you stable. What the balance therapy program does is it puts you through circumstances where your brain actually literally rewires and takes information in different ways. And the result is the brain learns how to respond quicker and tell your muscles quicker when they need to work to keep you steady. It absolutely works over time, and we've had amazing results with it. So I want to give you a few things that you can start with today in terms of some safe exercises that you can do at home. Certainly these are not going to be a significant driver to making your balance good again, but it's a place to start. It's something that you can do on your own without any real worry. So I want you to think back to when you learned how to ride a bicycle. At first, you made constant and deliberate corrections on the pedals, the speed you were going, but as you continued to ride, your corrections became more subtle and less conscious as healthy neuromuscular patterns establish themselves. So the same way that you as a youth developed skills is the same way that you can develop these skills or redevelop your balance skills as you're older. Never let anyone tell you that balance problems and falls are a result of being lucky enough to have decades of life behind you. Falls are not a natural part of aging, and you can absolutely do something about it at any age. So I want you to keep that in mind as you're doing some of these exercises. First of all, for safety, I want you to position yourself near a countertop or a sturdy surface that you can hold on to for support. Or go outside where you can perform exercises on soft ground away from other obstacles that you might hit if you fall. These exercises will make you a little wobbly, and that's basically how they work. So for us, it's a catch-22 because people come to us to ask us to help them with their balance. And we know and have to tell you that the first thing we're going to do is give you exercises to make you more unsteady. But it works. So, I want you to get started, but remember to not do anything that makes you feel uncomfortable. Always be safe. The point of these is to help your balance, not put you in a situation where you're going to fall. I'm going to give you 5 simple exercises conceptually that you can do to begin working on your balance by yourself. Number 1 is a standing march. You're simply going to stand in place and start marching in place with slow movements for 20 or 30 seconds. As this becomes easier, challenge your balance and change up the surface you are marching on. Go from a flat hardwood surface to carpet. Try a foam pad. Try grass outside. Number 2, standing 3-way kicks. You're going to stand on one leg. Don't lock your knee fully, just let your muscles support you on that one leg. You're going to move the other leg in front of you, keeping your knee straight, then out to the side, and then backward, and then back down to stance. Perform 10 times on each side. Number 3 is a sidestepping exercise. You're going to walk sideways along a countertop or near a wall with your hands on the surface as needed, just to make sure you're not falling. Step sideways in one direction, move 10 steps in that direction, and then go in the opposite direction. As it becomes easier, you can lessen the amount of touch that you use with your hands to support you. Number 4 is a one-leg stand. You're going to stand on one leg as long as you are able to, up to 30 seconds. Alternate your legs and try to do this 3 to 5 times on each leg. As it becomes easier, challenge yourself by doing other tasks while standing on one leg, such as brushing your teeth, talking on the phone, reaching a little bit in front of your body. Number 5, I give this to every patient that I see. It's just a sit to stand. You're simply going to rise out of a chair without using your arms to push up. If this is difficult at first, elevate the chair a little bit with a pillow and repeat it 10 times. If you need to use your arms, that's okay. So those 5 exercises are a way to get you started. I will backtrack to the sit to stand exercise because there is a significant way that you can find out if you are at a much higher risk of falling than the average general public in your age range. I'm going to assume that the listener is 65 plus, or the listener is a family member or friend of somebody who they are concerned with who has balance problems. So I want you to try what we call a 5-time sit-to-stand test, which means using your hands, you're simply going to sit in a solid chair and stand up and sit down 5 times safely and quickly. You're going to time the amount of time it takes for you to complete those 5 times up and down. You can have somebody help you if need be. If your time that it takes to complete up and down 5 times is not under 13 seconds, in other words, if it took you longer than 13 seconds to complete that, the longer it took, the higher your likelihood of falling is in regular daily activity. So I want you to make sure that you do that so you have an understanding. If that number is high, you really should look into physical therapy. So, what can we do next? The best advice that I can give you today is to seek the help of a physical therapist that specializes in balance and dizziness therapy. Our program at Achieva Rehabilitation specializes in treating people with high fall risk. We also specialize in helping those people get back their activity and independence without pills or a calendar full of medical appointments. So, like I said earlier, we have 3 easy ways that you can continue your relationship with Achieva Rehab. Ultimately, we just want to help you get to the solution that you're looking for your balance problems and your falls. I want you to call us, 1-888-929-7677. We'd love to be able to set up some physical therapy for you. We'll make all the arrangements. We'll be in contact with your physician. You don't need to go to the doctor. We'll take everything for you to get it started. That's number 1. Number 2, if you're not quite ready for that and you need to learn a little bit more information, that's great. We'd like you to schedule a free phone assessment with us, with our balance specialist. All you need to do that is go to our website, www.achievarehab.com. There's a button at the very top which says Schedule a Specialist Phone Call. Click on that, fill out a little bit of information, and we'll get that taken care of. It's very beneficial and easy. The third way is we'd like to be able to meet you face-to-face. So you can arrange a free discovery visit to meet us in person so that we can have a discussion and you can learn more about what we can do, and we can learn more about your problem so that we can lead you to the best solution. In the end, we just hope to be able to impact you positively and reduce your fall risk going forward. Ultimately, the absolute best way to do that is with a great physical therapy program. These other ways will get you information and get you started on a relationship where we hope to guide you down that path to improving your balance. Whatever speed you would like to take this relationship, that's up to you, and we're fine with it either way as long as we're helping you. Finally, I do want to just put a disclaimer in here for this podcast. All content and media in the podcast or on the Achieva Rehabilitation website is created and published for informational purposes only. It is not intended to be a substitute for professional medical advice and should not be relied on as health or personal advice. So I wanted to thank you very much for listening. If you are dealing with fall problems or balance problems, please take this information very seriously. One fall leads to more. We see it all the time. We've been doing this for 15 plus years, working with people with balance problems. If you are listening because you're very concerned about a loved one, a mother, father, aunt, uncle, family member that has fallen once or has some balance difficulties, please get in touch with us. Please take that information equally as serious. Sometimes it ends up being too late when we start thinking about balance. Take care, everybody. Hope to have you guys listen again on the next one. Please contact us with any questions. We're here to help.